Hello, my friends. I'm Dr. Armen Astvatsatryan, professor from Yerevan, Armenia. So you are on Dr. Y. For you, I'm Dr. Y. So when we talked about approach to the gastrointestinal patient, I forgot to talk about. Actually, not forgot. No time to talk about functional gastrointestinal illness. Functional word functional means functioning. Function is a Greek term, means work. When we talk about in medicine about functional disorders, functional illness, functional problems, it means there is no pathology in the body. For example, functional gastrointestinal illness, not pathological disorders, not pathology in organ. But function problem is with functioning of normal organ. Okay? So means good functioning means good working. Okay? We translate from Greek. So often no objectively measurable structural or psychological abnormality for gastrointestinal complaints is found, even after extensive evaluation. Such patients are said to have functional illness, which accounts for 30 to 50% of referrals to gastroenterologists. Actually, not only gastroenterologists, in cardiology, in general medicine. More than half of the problem are so-called functional. Means, once again, no pathology in the level of organ, but pathology in functioning due to brain, of course. So often, once again, no objective measurable structure or psychological abnormality for gastrointestinal complaints is found even after extensive evaluation. No psychological we have to find anyway. So, but no measurable structural. So no problem. When we talk about, once again, functional problems means no structural disorders, no objectively measurable structural disorders. But psychological abnormalities, yes, I am not agree with the author. So such patients are said to have functional illness, no structural, which accounts for 30 to 50% of referrals to gastroenterologists. Functional illness may manifest with upper and or lower gastrointestinal symptoms. No, for example, the classic is irritable bowel syndrome, but we will talk with that once later. Irritable bowel syndrome. Functional gastrointestinal disorders are disorders of the gut-brain interaction. Gut-brain. Some evidence suggests that such patients have visceral hypersensitivity. A disturbance of nociception is which they experience discomfort caused by sensation. For example, luminal distension. Peristalsis that other people do not find distressing at all. Hyperreactivity, absolutely. Just functional disorders are classified by symptoms related to combination of not only visceral hypersensitivity but also motility disturbance, altered microbiota, mucosal and immune function, and central nervous system processing. In some patients, psychological conditions such as anxiety, with or without aerophagia, conversion disorder, somatic symptoms disorder, or illness anxiety disorders, previously called hypochondriac patients. I don't know why now they talk about illness anxiety disorder. It's the same thing. Illness anxiety disorder is previously was hypochondriasis. So they're all of them, conversion disorders, somatic symptom disorder, illness anxiety disorder, are associated with gastrointestinal symptoms. Psychological theories hold that some functional symptoms may satisfy certain psychological needs. For example, some patients with chronic illness derive secondary benefits from being sick. They said, I can resolve all my problems in my life, but unfortunately I'm sick, I'm ill, so leave me alone. And it's like a shield to protect from the everyday problems. For such patients, successful treatment of symptoms may lead to development of other symptoms. Many referring physicians and GI specialists, gastrointestinal specialists, find functional gastrointestinal complaints difficult to understand and treat, and uncertainty may lead to frustration and judgmental attitudes. Yes, very often. For example, in me, such patients with so-called illness anxiety disorder, for me it's better to treat 5 patients with, or 50 patients with real myocardial infarction or with these problems with nervous system. It's very difficult to treat. First of all, difficult to explain that patients are okay, no structural disorder. It's absolutely impossible to explain. This patient goes to one doctor, to another doctor, and finally change a lot of doctors and a lot of examinations, a lot of treatment, but zero efficacy. Physicians should acknowledge the patient's symptoms and provide empathy. Physicians should avoid ordering repeated studies or multiple drug trials for patients with inexplicable complaints, because this may promote symptoms anxiety and health care seeking behavior. Care seeking behavior. Yes. So when symptoms are not suggestive of serious illness, the physician should wait rather than embark on another diagnostic or therapeutical plan. In time, new information may direct evaluation and management. Functional complaints are sometimes present in patients with psychological disease. For example, peptic ulcer, esophagitis. We can say that actually peptic ulcer very often is a nervous disorder. Yes. So without treating nervous system, it's very difficult to treat peptic ulcer. As such, a lot of other chronic diseases, the chronic disorders. So functional complaints are sometimes present in patients with psychological disease, esophagitis, peptic ulcer. Such symptoms may not remit even when the psychological illness is addressed. In some patients, testing, for example, computer tomography, may identify incidental abnormalities that are unrelated to the symptoms. And patients said, for example, computer tomography, they find something not okay in the, for example, in this situation in gut, in bowel, this is my problem, and they said, I am okay. Yes, it's unrelated to the symptoms. Very difficult to explain, but you have to. So actually, that's enough. Concerning this functional gastrointestinal illness, that's all I want to say. Maybe we will talk about this concerning in future lectures concerning irritable bowel syndrome. That I want to say, it's these disorders, functional disorders, are difficult to evaluate, to explain the patient that there is nothing catastrophic at all, and have good relations, even friendship relationships with patient, but not go to to insisting of this patient to prescribe medicals. Be careful with this. So that's all concerning gastrointestinal functional disorders, illness. Thanks for your attention. Don't forget to help us in terms of subscribe. Don't forget to subscribe. Put your likes, finger up, thumb up, and please, yes, subscribe this channel, and if this is possible, make your donations, because without your donations our channel cannot exist. How to make these donations you can find in the description of this video or directly by YouTube. Bye and have a nice day. See you in another lectures. Bye bye.